All right. Yeah, this is what I would be able to do. Yes, I'm sharing this screen, and I hope you can see. And we were here yesterday. So on question number 15. So yes, this is where we were yesterday. So now we go to question number 16. Are you hearing me properly? And you are able to see my screen?
Yes, please.
Yes, please.
Okay, thank you so much. And
Yes.
and I say hello to everyone.
Hello.
Hello.
So let's try to see. Yes, from my view is that microbiology is that I don't have any question to skip, like to maybe one or two questions, but everything here is very, very interesting. Everything here is very, 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 very critical. And microbiology is really very wide. So we have to spend enough time on microbiology, at least so that we can cover adequate. So the question number 16 is, it says, which of the following is the most appropriate specimen source and primary media selection? Here we have source specimen, and we have also media, and they are trying to ask which one is good for which media. For example, we have CSF. The media that are listed are Columbia, CNA, McConkey, endocervical, chocolate, Martin Lewis, sputum, sheep blood, Martin, KVLB, we call it KVLB, clindamycin, vancomycin, like the blood agar. Then we have urine. We are given sheep blood, chocolate, and Columbia, CNA. So which one do you think is appropriate for which sample?
B.
Endocervical for chocolate and Martin Lewis. Anyone else? We'll explain why, isn't it?
Okay.
If that one is going to be considered. Anyone else?
A.
A. Okay, A and B. Anyone else? Yes, then you have A and B. Maybe let me see. Immaculate. I think Immaculate is the one who chose A. Why did you consider A? CSF for CNA and McConkey.
Well, because CNA would give us the gram positives, and then McConkey will give us growth on of the gram negatives. So having CNA on rather CSF on CNA and McConkey, I would clearly identify the gram positives individually and gram negatives also individually.
Okay, thank you so much, Immaculate. But the one thing you are missing one thing. I think you're missing here. They don't want someone maybe to choose because we want to identify a bacteria separately, but they gave you a sample and they want you to know which bacteria, because we have sample in lab. Before you do any culture process, you have to first of all suspect. Okay, you have to suspect, and so you suspect which bacteria, which bacteria am I suspecting in this sample? CSF, which gram-positive bacteria do you suspect in CSF? CSF is normal, is a body fluid, is a very sterile body fluid, and CNA will just have to we use CNA as a selective medium when the sample is really very, very, very contaminated. I mean, can I say contaminated or mixed? We can call it mixed microorganism. When we want to prefer only gram-positive, especially staph and strepto, we use CNA. Now, we don't use it when the sample is not that contaminated like that, or when it is not mixed, especially mixed flora in the sample. So we chose B because, first of all, CSF CSF is a stellar body fluid, and most bacteria we suspect in cerebrospinal fluid are fastidious. Most of them are fastidious. Okay, so because, for example, you cannot forget even Martin Lewis. You remember yesterday we talked about Martin Lewis, and we said that Martin Lewis is used for Neisseria, especially Neisseria meningitis, no? Which is associated with meningitis. Neisseria meningitis, Martin Lewis is good, and it can even grow on chocolate agar, but also others which can also cause meningitis, including, for example, Haemophilus influenzae, and also which one is Streptococcus pneumoniae is also associated with meningitis. So Streptococcus pneumoniae requires chocolate because Streptococcus pneumoniae is a bit fastidious. Haemophilus influenzae, the same thing, also can grow on chocolate agar, and Martin Lewis can support Neisseria meningitis. So because we are suspecting those bacteria in CSF, that's why, oh, sorry, not CSF. We are talking about endocervical specimen for chocolate and Martin Lewis. So this one is for Neisseria gonorrhoeae. Yeah, and similar organism. So sorry, it was not CSF. So, but CSF, of course, we explained we can't use CNA and McConkey because CNA is used for that, for the what I explained, and then McConkey agar is only used for gram-negative, and we don't expect any gram-negative, any Enterobacteriaceae, because McConkey is used mostly for Enterobacteriaceae, and we don't suspect any Enterobacteriaceae causing meningitis, so we can't use McConkey agar. So that is the reason why. So is that we are given sample before we choose a culture media. We have to first of all think which microorganism would be suspected in that particular specimen. Okay. Otherwise, what we call Martin agar for sputum, for example, I say sputum, the C, sputum sheep blood agar can be used. Yes, for sputum sheep blood agar can be used. Yes, but Martin Lewis, Martin agar is not necessary, and even KVLB is used for anaerobes, medically important anaerobes. We use KVLB. It is called kanamycin vancomycin laked blood agar. So we can't also use it for sputum, mostly because sputum sample is not used, is not really a good sample from anaerobes. Urine also, there's no need of chocolate agar for urine sample. So even sheep blood agar, do we even culture urine on SBA? It's not possible.
No.
Okay, if we do, sometimes it can be very rare. Okay, thank you so much. So next question is, which of the following is the most appropriate organism and media combination? So here we have organism and media. The first one was specimen and medium. Here we have now organism and medium. Maybe this one is easier. Okay, which one? We have Vibrio stilo, enterohemorrhagic E. coli, PEA, Campylobacter species, charcoal yeast extract, Yersinia enterocolitica, CNI or CIN. Which one is most appropriate combination?
These are grammars from them.
Sorry? Yes, Paul. Yeah, who can give us idea? Which one is sorry, yes, yes, who?
I think
Yes, Doris.
Vibrio species with strip.
Doris. Oh,
Yes.
Doris, what do you say? Yeah, yes, yes, Doris. Which one do you choose? Yeah, from the list. Yes, anyone else can tell us, no problem. Then we'll look at it maybe one by one.
I'm choosing A.
What is on
A.
virus?
You are choosing A. Olive, are you choosing A?
Yeah.
Okay. Vibrio and Skilo. Someone else?
I'm taking C.
Campylobacter species and charcoal yeast extract. And then D. Okay. Now, Vibrio. Let's start from A. Vibrio. Vibrio does not need a Skiro. Vibrio requires what is known as TYBSC. It is not Skiro. Skiro is used for kindly mute yourself. If check your microphone is very important. Yes, Skiro is used for Campylobacter species, especially Campylobacter duodenii. This is Skiro agar. And then we have so it is not used for Vibrio for sure, because you can use maybe hecton enteric or hecton water, then with subculture on TBS. That one is for Vibrio, for isolation of Vibrio species, but Skiro is used for Campylobacter species. Enterohemorrhagic E. coli, there's no way you can use, I don't know if someone chose B, but there's no way we can culture E. coli on phenyl ethyl alcohol, because phenyl ethyl alcohol is a selective medium for gram positive, not gram negative. It can even destroy gram negative. Then we look at someone chose B, maybe Remings chose C. Charcoal yeast extract. Yesterday we mentioned it. Charcoal yeast extract is used for Legionella. Legionella is not used for Campylobacter species, the charcoal yeast extract. So we are remaining with the D. I was trying to eliminate that kind of elimination method. Now we are remaining with the D, but I'm also going to explain why we use a D. In fact, CNI is a selective medium for Yersinia, but mostly we use it for stool, Yersinia enterocolitica. That was stool sample, because the Yersinia is a pathologic, is a enteropathologic, is a pathologic enteric bacteria, Yersinia enterocolitica. So we use the phylodine, ilagacin, novoberchin. So this is what we use for Yersinia enterocolitica. So you will see it also in our notes. We have Yersinia enterocolitica, and you will see a culture media that we use or we described. Though you may see more than this, but this one is very specific for Yersinia enterocolitica. Okay. All right. Let's look at question number 18. Question number 18. Gram stain from a swab of a hand wound shows moderate neutrophils, no squamous epithelial cell, moderate gram-positive cocci in cluster, moderate large gram-negative bacilli. Now, first of all, let's understand these findings. We have moderate neutrophils, so which means that there is, of course, inflammation process. No squamous epithelial cell, which means the sample is really corrected properly. And moderate gram-positive cocci means that you may suspect what Staphylococcus species. Then moderate large gram-negative bacilli, of course, large gram-negative bacilli, of course, there are, of course, gram-negative bacilli, but they are not specific here. No one that's specific. Maybe whether you say Escherichia, whatever you say, but it's not specific for this case. Select the appropriate media that will selectively isolate each organism. Which media that will isolate each organism? Because we have two organisms here. We have moderate gram-positive cocci in clusters and large gram-negative bacilli. Now, which one that is going to be used? We have Kivel, Lake agar, Thiomartin agar, shea blood agar, McConkey agar, Columbia CNA, chocolate and Columbia CNA, and McConkey agar. Which one is good? The two.
D.
Just B.
Columbia CNA and McConkey agar.
Okay. I think all of us are agreeing on D. Okay. Very good. It is Columbia CNA McConkey agar. Yes, because first of all, is that to understand the sample. The sample is from a wound. It's from a wound. First of all, we want to make sure that we identify wound infection, which may be associated with the Staphylococcus aureus, and we have to use DNA in order to isolate Staphylococcus aureus, and we take a part of the sample, we culture it on McConkey agar in order to identify that gram-negative bacilli. Yes, that is very good. So CNA, which is for positive, then McConkey agar, which is for gram-negative bacteria. Okay. Okay, we have now then question 19. Organism that must be incubated in a microaerophilic environment for optimal recovery is which one? Microaerophilic environment, it is environment where we have to reduce oxygen. It must be minimized, very minimal. That's what we call microaerophilic environment.
Option A.
Option A. Duodenine, Campylobacter. What about Pseudomonas? Pseudomonas aeruginosa. No, don't worry. It is Campylobacter, not Pseudomonas. We are trying to confuse. So Pseudomonas aeruginosa is just aerobic. It's very purely aerobic, It's aerobic bacteria. So Escherichia coli and even Proteus are facultative, isn't it? They are facultative anaerobes. So Campylobacter duodenine is is microaerophilic. It requires very minimal, very low concentration of oxygen. Okay, thank you. But if you don't disagree with us, it's important you can raise your hand and tell us because we are just trying to answer questions.
Just a concern. If you may be able to name other microaerophilic organisms, or just information.
Most fastidious organisms are microaerophilic. most, including even, those ones that require CO2 and small amount of oxygen. For example, Vibrio cholerae. Not Vibrio cholerae. I mean the Neisseria gonorrhoeae, Haemophilus influenzae. All those, most of those that are fastidious, they require this condition, and they usually need also high concentration of CO2, so they are also capnophilic. Usually we have a group of microorganisms that are known as capnophilic microaerophilic bacteria, so including those ones. Most fastidious are gram-negative, of course, except the Streptococcus pneumonia is not, doesn't require this condition. It is a facultative anaerobe. Yeah, so we have them there. Microbiology is very wide. So it requires you to consider all characteristics of bacteria. That's why reading and understanding is very key for this. So question 20. Question 20, now it is about the Vibrio parahemolyticus is best isolated from feces on. Okay, but here for me to remind you here is just to confuse you. Vibrio parahemolyticus, it doesn't have anything special from other Vibrio. Just a little, like maybe being hemolytic. But when it comes to selection of culture media, it doesn't have much special. So, but that is considered as Vibrio. Vibrio is best isolated from feces on EMB, Hecton enteric, Salmonella, Shigella, and then thiosulfate, citrate, bile salt.
TCBs.
Yeah, I think I was mentioning this thing before even. I remember I was mentioning something like TCB something. Yeah, it is. It is TCBS.
Yes.
Yeah, TCBS is used for Vibrio, whereas Hecton enteric agar, for example, it is used for Salmonella. Actually, the two of them are the same. No, okay, not the same, but they're used for the same bacteria. Hecton enteric agar and Salmonella Shigella, both of them are used for Salmonella and Shigella. Then we have also Eosin Mediterranean blue. You remember yesterday, someone gave us idea that this is actually used for Escherichia coli. So yes, then we are remaining with the sulfate citrate bile salts. Okay. Then we have question number 21, which is now I need to actually I can even put this one here. Okay, that is good. Okay, then question number 21. No, this one is not necessary. Yeah, we have been talking about the Legionella many times. Legionella. So okay, let's answer it, no problem. So media used to support growth of Legionella pneumophila should contain which additive?
Yeast extract.
Corn yeast extract.
Yeah, charcoal yeast, charcoal and yeast extract. Yes, the C.
Yes.
One we have been talking about it always or every day. Yes. So then we have the best medium for culture of Bodetera. Now we have what we call B. pertussis. So for cough, whooping cough, Bodetera. So which one do we use? You remember this one? Everything
It
is
is a
there.
C. Regan Low.
Regan Low. Regan Low is used for
This media for culture for Botulina pertussis is
yes. Regan Low agar is used for Bordetella pertussis. So And then we have also potassium tellurite blood agar. This one is also is special for diphtheria. Huh? Yes, it's for diphtheria. This is potassium tellurite.
Bacteria, diphtheria, yes.
Yeah, the last one I don't even remember it. Francidella. I think sometimes ASCP can confuse you with some terms that we don't even have here in our countries. Okay, most of them we don't have them. That's okay, Tricidella agar, so maybe we'll look at it. But potassium tellurite blood agar is for Conibacterium something. Diphtheria, yes. Okay, and you remember the PEA. The PEA we have been also talking about it. It is from gram-positive. Okay, then look at question number 23. Question number 23. A 21-year-old patient present with pharyngitis, and a throat swab is collected and submitted for an LB culture. This one is just pharyngitis, and this person is 21-year-old, and the person is having pharyngitis, and you have collected a throat swab and submitted for an LB culture. So this specimen should be set up immediately. Should be rejected as unacceptable. Should be inoculated into tigercorrect broth and should be sent to the reference laboratory immediately. So what shall we do here in this case?
I think we are rejecting.
Why do you reject the patient sample with serious pharyngitis, my friend Oliver?
Because, well, we need it. We need an anaerobic culture. I don't think a throat swab is going to give us an anaerobic organism.
Yeah, that's good. That's good. So we don't. Throat swab is never used even for anaerobic organisms. That's why. And you know, pharyngitis is caused by what? Pharyngitis is not caused by anaerobic bacteria. Pharyngitis is associated with which bacteria, Olive?
Strep.
Streptococcus pyogenes. Yeah, Streptococcus pyogenes. That one is called group A, gas. It's called gas. Okay. Then you have to reject the sample because it's not acceptable sample. Then we have 24 antibiotic used to suppress or kill contaminating fungi in medium. I think you have everything in our notes, but it requires you to read and consider every paragraph for sure. Which one here? Which is used to kill contaminating fungi in media? So contaminating fungi is like those ones that are growing very fast.
I think it's cyclohexamide.
Someone else? We have amphotericin B and the penicillin.
A is for antibiotic. It's for bacteria, so it can be A.
And what about amphotericin B?
It can. I'm trying to rule out here.
Yeah, you know, everything here is what is the most, something like that. Yes. This is a cyclohexamide is actually used. Is a standard one. So amphotericin B is a therapy, is a drug we use to treat them, but we don't use them in media. And even penicillin, we can't use it for fungi, yes, because they are in combination. But even if penicillin is not there and they give amphotericin B, you cannot choose it because it is just, yes, it is antifungal drug, but it is not used in this protocol. Now, here you have a picture. Look at this microscopic slide. This is a total magnification is 100, which means it is low power field. Now they say the sputum specimen is received for a culture and the gram stain. The gram stain smear from this specimen is seen in the image. This is a gram stain. This is our gram stain of sputum. Remember, this is a sputum. Because I'm going to scroll down. This is a sputum, and we have this as a picture we have just taken in microscope. So what can you do as a technologist? Technologist will inoculate appropriate media and incubate anaerobically. The technologist will inoculate appropriate media and incubate aerobically. Call the physician and notify him for this is life-threatening situation. Then call the patient care area and request for a new specimen. What can you do in this situation when you see these things? This is 10 objective.
It's 100, but please can you scroll on the options so we can view them?
This is not 100, isn't it?
They said it's 100.
The total magnification is total magnification, it is 100. So which means it is 10. Isn't it? The objective is 10. Huh? Total magnification is 100. So which means the objective used is 10. It is low power field. Hmm? Hmm? Isn't it? Or it looks different. Mm-hmm. If you agree with me, so now, what's the course of action? Mm.
I want to view the options properly. I've seen the picture, now I want the option.
Okay. They're together with the picture. I hope you can see even the picture.
But I only see two options.
Try to focus, huh? Because the picture is just a picture.
Yeah, I've seen the picture. Yeah, I've seen now. Sorry, it was on my end. It's okay now. I think we're gonna need a new specimen. Most of what we're seeing are, I think, squamous epithelial cells or something.
Why do we need that?
Because I think for sputum, if you have, I think, more than 25 squamous epithelial cells, the sample, okay, the rejection criteria, the sample is mostly saliva, so you would need a different sample or one that is collected well.
So which one here is a epithelial cell? The blue one or the pink one?
Oh, the pink ones are cells, squamous epithelial cells.
Okay. Do we agree? For the rest of us?
Yeah.
Okay. Yes, we do agree. It is true. When you focus properly, you can see this is just squamous epithelial cell, with very small, pink nuclei, very small one. And even cytoplasm is pale pink. So, because you remember when you have seen more than 25 epithelial cell, low power field, as a rule, you have to reject sample because that is not saliva. No, that is not sputum, but is saliva, and saliva is not a good sample. Or sputum contaminated with saliva is not a good sample for analysis. Okay, let me put this thing here. All right. Question number 26. It is what? Vaginal rectal swab corrected from a pregnant patient to
Excuse me,
screen
sir.
for.
Excuse me, sir. Did you say 25 in low power field?
Yeah. Low
What
power
about
field.
if it's 100 times objective? What
No,
should be the
quality? That's one we call it quality assessment for quality control of the sample. We do quality control of the sample using 10 objectives, so we don't use 100.
Okay, thank you.
Yeah, we don't use one. When it is always done, always you must do it when you receive. Okay, let's say when you suspect, but even if you don't suspect, even if the sputum is just expectorated, like that, the first one we have there, it is expectorated sample. It is already expectorated, but probably patient mixed a good sputum with saliva. So that will actually damage the quality of that sample. So for you, what to do is not visual. You just have to do microscopy. Gram stain is better. Yeah, it's better. Do gram stain, then use first of all objective of 10. Because when you use 100, you are going to see very few because of the decrease or reduced size of the or identification area is reduced. So you can't count even more than 5 or 2 or 3. Yes, you test quality using 10, objective of 10. So now we have this one. This one we have corrected vaginal swab from a pregnant woman, and we want to screen for group B streptococcus. Which one is group B streptococcus, first of all? Which one?
Strep agaracti.
Yes, Streptococcus agaractiae. So Streptococcus agaractiae is what you call GBS. GBS. So GBS is usually a problem. It is not a problem for adults. It's a problem for newborn and even previously pregnant women after delivery or after abortion. It can also cause a problem, and also it can cause a problem for elderly people. Remember, it's there in the content. It is listed. Yeah, disease associated with Streptococcus agaractiae. Because even if we are lab professionals, we need to understand even disease process, because you will know now the sample and findings and the correlation. Okay, Streptococcus agaractiae doesn't cause any disease in adult health people. So only small babies, previously pregnant women, maybe because of abortion or something like that, and also elderly patient. So now, for this woman, Streptococcus agaractiae have colonized this patient vaginal or rectal. So then the medium to inoculate the specimen is to inoculate to CNA, LIM, sheep bladder, and thioglycolate broth. So which one is best for these group B streptococcus?
Lame broth.
Oh, Sure. Layer M. Okay,
Yeah.
someone else?
I think it would be CNA.
DNA.
Mm.
DNA. Uh-huh. Layer M, CNA. And then?
Because now, like for sheep blood, it would be good, but there would be, I think, a lot of contamination, and we cannot be able to isolate the group. I mean, the galacti well because of the contamination.
So you would choose sheep, but you have a problem that it would be contaminated with many things. Huh?
Yeah.
Someone else?
I'll go with limb broth because it is a selective for the same
Yeah.
group, the streptococcus.
Okay. All right. Yes. Yeah, it is limb. It's limb blood agar. It's true. It's limb blood agar. We don't use CNA for that. The best one for GBS is actually limb. So limb or toddy hewitt broth. It usually, huh? Sorry? Yeah, so this is good for Streptococcus agarictiae. The limb agar, I mean not agar, limb broth. So we can use it for that, for isolation of Streptococcus pyogenes. So I mean Streptococcus agarictiae. So it is. We can also use yes, as I don't know who said it, maybe Mohammed. We can also use the sheep, the SBA, but yes, we have issues with the SBA cannot support it, but you have issues of these heavy contamination. So yes, now we are on question number 27. Number 27 is a process. 27 is just theoretical thing. Let's go to question 28. 28, a wound specimen grows to two colony type. Here we have a wound, and the wound is showing two colony type on sheep blood agar, and one clear colony type on McConkey agar. Sheep blood agar grow is documented as. So let's read this question carefully because it's a bit confusing. So now we have a wound specimen which grows two colonies on sheep blood agar. So it means the colonies are different. Then it has like when we grow it on McConkey agar, it will grow only one clear colony. So now we are going to report only the colonies that are seen on sheep blood agar. Sheep blood agar, we have one colony which is swarming over entire plate, gram-negative bacilli. The second colony on SBA is also a white colony, gram-positive cocci in clusters. First of all, before we interpret, what do you think would be the colony type 1 and the colony type 2? Because I remember we have done this course in microbiology, interpretation of colony morphology. Which one would be type 1 and type 2 in your view?
Maybe type 1 would be Proteus.
Proteus.
And then type 2
Okay, swarming
would be
Proteus, type 2.
And type 2 would be Staphylococcus.
Which one?
Type 2 stuff.
Aureus.
Aureus.
Yeah.
Maybe not Aureus because Aureus is golden.
Yeah, Aureus is not that
White colony.
not that white. Huh? Yeah, it's not that white. You know those ones that are white, those are known as coagulase negative Staphylococcus.
Maybe epidemides.
Yeah,
Epidemides.
yeah. They are known as coagula. You remember there's a picture. If you read notes there in
Cones.
colony morphology, there's a small picture you will see which is very white, small, small, small. And those one are CONS. They're known as coagulase negative staphylococcus or staphylococci. Okay. Now we have already tried to identify types of bacteria. Now let's look at this question. The best way to isolate colon type 2 from colon type 1 is to subculture on what? Colony 1 to be subcultured to sheep blood agar and chocolate agar. Colony 2 to be subcultured on sheep blood agar and maconche agar. Colony 2, sheep blood agar, chocolate agars, CNA and PEA agar for colony 2 only. What do we do for colony 1 and colony 2?
I think B.
Colony 1 on?
Type 1.
Blood agar and maconche agar. Colony 1.
Option D, because already we have a colony 1.
Hello, good evening.
Already kind
Yes.
of isolated in maconche.
Yeah,
So now
to IT.
Yes, please. So please, let's Mohammed finish. I think Mohammed is the one who was explaining to us.
it was Daniel.
Oh, okay,
Yeah,
Daniel.
So I was saying I think I'd go with option D. Since earlier on, maconche had already given us purely the gram-negative. So now that means we would need to have a plate that can help us isolate on the gram-positive. That is now the CNA and the PEA agar.
So it means you are going to choose PEA for gram-positive?
Yes. Yeah.
And CNA for gram-positive?
Yeah.
Why don't you choose SBA and sheep and the maconche agar? Colony 1.
That would be swarming by the proteus.
Colony 2 to sheep.
Sorry?
Because if we choose C, the proteus will swarm and would not be able to isolate the colonies. And yet on so basically it would be D that would help.
Yes, I like the point. Actually, it does not swarm, cannot swarm. Yes, so here is to be careful, because now we are going to even to avoid problems because we are taking colony, we are doing subculturing. It's not that we are having a pure colonies somewhere. We are doing subculturing from blood agar to another colony. So for this one, the D is the best, because CNA, first of all, it's going to help us identify those gram-positive cocci in clusters, and even PEA can also do it, okay? And PEA is also useful for proteus, the same thing. Yeah, and for proteus, it is used for proteus because it prevents swarming problem. The PEA, so it can grow gram-positive and prevent swarming. So that's why we can try to subculture the colony type 2 on these two, either CNA and the PEA.
But what if we argue this way? That with colony type 2, their morphology was saying that it was gram stain, gram-positive cocci in cluster. But now with colony 1, which was swarming, is different. Now on our answer D, we are using only colony 2.
Yeah,
of
yeah,
which
yeah.
would
Where's the
also
only colony too?
consider swarming, of which colony 1 was the one which was swarming. Why should we go with the B?
Because the question wants us to isolate 2 from 1, so we should put emphasis on 2.
Yeah, 2. Yes, sure. Yeah, we are emphasizing now on 2, not on 1, because now on 2.
Also, the other reason is that on blood agar, the primary culture. Remember, they're saying a wound specimen grows 2 colony types on sheep blood agar. So on sheep blood agar already, we are not going to eliminate swarming. So which means much as this colony is clear, around it there can be already proteas that are swarmed around.
Yeah,
so
yeah,
you can
yeah.
keep pure colony.
Oh, that is another good. That's another good argument. Of course, that's a very good idea. Now that we have already 2 colonies, and 2 colonies are identified, and even if we have swarming, we have isolated colonies that are not swarming. So, and we are going to subculture them. So, but even if we do that, even if there is a contamination, the PA and CNA cannot support protease. So then they cannot be supported because of the content of the ingredients there in PA and CNA. So because first of all, these are there to inhibit gram-negative bacilli, bacteria in general. So we can use the CNA and PA to just take 1 colony 2 and we subculture it onto this medium. Yeah, so it's important to brainstorm, and that's how the exam is. And I hope it is really generating a very good view and information. Okay, now I don't know if we can let's jump down to this question. Let's see this one. Okay, this one is also it is also easy question, like 30. Question number 30, where it is asking which anticoagulants acceptable for use with blood, bone marrow, and synovial fluid specimen that are to be cultured. You remember which one here? First of all, which one here can we use? Because we still have like 3 questions there to answer before we start another section tomorrow.
C.
C. Yes, yeah. So anticoagulant, you remember we use SPS, but we don't use DTA. So we use SPS or less commonly heparin, but the most commonly used is SPS or sodium polyanethyl sulfonate. You remember the function is to act as anticoagulant and also destroy or inactivate neutrophil and the complement proteins that are there to destroy our bacteria. Okay, now we have appropriate culture requirements for a specimen from patients suspected of having tularemia. Now we have Francisella tularensis. You remember this bacteria, Francisella tularensis. Now we have very special media here. But there's one thing that I want you to remember from the notes, which I'm sure you read before. Which one is used best for tularemia? Remembering this is Francisella tularensis.
I'm gonna go with a C.
With a C. Milantonaga with the sheep blood.
5% blood. Yeah. I've just elimination.
So are you eliminating? You have already eliminated everything. I thought you are starting to eliminate one by one.
Yeah, I eliminated one by one, and I was left with that.
You're left with why did you eliminate A and B and C and D?
A is for Legionella. B is for gram positives. C is for whooping cough, Bordetella. But I know Clarensis and whooping cough and Bordetella are in the same category, so I almost chose that. But yeah, I go with that because I don't know where that even falls.
If you read notes, you will see this one, cysteine. Cysteine is very important for tularemia, for tularensis. It can't even grow without cysteine. You will see where there's some arguments there, or some concepts where we say without cysteine, with the cysteine, and we see how it grows. Yeah, so when sometimes we need to add this amino acid cysteine, so to support growth of branchicella. Yeah, it is A. This is what we use, especially the cysteine. When you see cysteine, remember tularemia. Okay, yeah, that is something I try to recall, which is also there. Okay, now that you have the 32 says a primary isolation of Neisseria gonorrhea requires what? Yes, 32.
Carbon dioxide.
It requires what? Anaerobic.
Carbon dioxide. No, sorry, carbon dioxide.
Yes. So as we explained before, we say that carbon dioxide is a requirement for most capnophilic. Yes, not most, all of them capnophilic bacteria, and fastidious organisms. Most of them are capnophilic. That's what it is. Not my research, but it was what I realized from readings. So I found that most of fastidious organisms require CO2. They are capnophilic. Most of them microaerobic. So Neisseria gonorrhea is also in that category. So it grows best in the presence of adequate carbon dioxide, usually 95% CO2. Okay, then we go for 35. 35, not 35. 35 is a part of another section. Probably we can, because of time, we can continue tomorrow. God willing, if possible, tomorrow. Sorry. Let's continue tomorrow by also exploring others as well, and see how yes, this actually gives us some package, because yes, we need to read, but at least reading after this, you'll be empowered when you are reading. Be empowered, remembering what you are supposed to capture and memorize sometimes, or master when you're reading. Okay, thank you so much. Have a restful night, all of you, and I really appreciate your attendance and your participation. And yes, I'm hoping that throughout this week we can be able to meet, even if we meet for a few minutes, at least to do something. So I appreciate. God bless you, and see you later, maybe tomorrow.
Thank you. God bless you too. Thank you.
Thank you.
Thank you.
Thank you.
Welcome to Triumph Class, your trusted partner for professional growth and success. At Triumph Class, we offer high-quality online training programs designed for medical laboratory professionals, registered nurses, and healthcare practitioners around the world. Our programs include preparation for the American Society for Clinical Pathology International Certification, known as ASCPi, NCLEX licensure exam training, and English proficiency courses for IELTS, TOEFL, and PTE. With Triumph Class, you can upgrade your skills, earn globally recognized licenses and certificates, and advance your career to new heights. Join a vibrant community of learners, and take the next step toward your professional triumph today. Triumph Class, your journey to excellence starts here. To get started, contact us today. WhatsApp, +250 781 512 814. Email, info@triumphclass.com. Or visit our website, www.triumphclass.com.